This podcast is brought to you by the Angry Unicorn Method. If you are struggling with your own programming, this is a free daily option for you. Check them out. Instagram, the Angry Unicorn Method. This podcast is also brought to you by the Drawing Room, Davenport, Quad Cities' best cigar lounge. If you are in the Quad Cities area and you like cigars, you must check this place out. Facebook, the Drawing Room. Hey guys, welcome to Paradigm Shift Podcast. On today's episode, I was able to sit down with Joel Pasloski. He is a practicing manual therapist in Calgary, Alberta. He is a registered massage therapist. So we talked about industry stuff. I got to pick his brain a little bit. He is a up-and-coming guy in the Calgary area, and he's a free thinker. He is an innovator, and he's a great dude to boot. So enjoy the podcast, guys. Hey, Joel. How's practice going, buddy?
Practice is going great. I started at a new clinic, God, actually exactly a year ago
Okay.
today. I just remember it because it was the second Saturday after the first lockdown in
Yeah.
Alberta. And yeah, I just started it one day a week, filling in for someone who had left the place. And yeah, slowly added days until I was at full time for a massage therapist in um like late August, early September.
Nice.
Full time for a massage therapist is uh, a whole 20 hours a week of treatment.
20 hours of
But
treatment.
yeah,
That works out to be more, obviously, in actual hours that you're working with charting and whatnot, though, right?
yep, yeah, for sure. Charts could take anywhere from 2 to 10 minutes each, depending on how focused I am.
Yeah.
Usually more on the longer end, but I try to do it immediately after each patient, so everything's fresh in my mind and I don't forget because every treatment is tailored to who I'm seeing, right? It's easy to forget specific things when it's not fresh in your mind.
Yeah. So tell me a little, like, I live in kind of a COVID bubble that hasn't been super affected. Like, we didn't have the mass lockdowns uh, as extended as Calgary, which is where you're practicing. So tell me a little bit about practicing inside of a pandemic.
Oh, inside of a pandemic, yeah. Calgary was a hot spot for quite a while.
Yeah.
Um, what I noticed, the first thing that comes to mind is the way that my schedule would slow down when new restrictions were announced because the restrictions announcements from the government was not always so clear on like massage specifically. Some people didn't know whether or not massage was opened. Um, so in December we were shut down for 2 weeks when we were supposed to be shut down for four. Um, and what happened in that time, they reassessed. I'm not quite sure all the details. I was just happy to be back at work early, but we got shut down for 2 weeks when it was supposed to be four, and then we were lumped into massage got lumped into healthcare, so meaning that we're deemed essential workers now. So that was pretty awesome. I think it's a good step in the right direction for massage in general, but specifically massage in Alberta.
Gotcha. So tell me a little bit about how you treat people. Like, what are your assessments like? How do you come up with a treatment for somebody?
When it comes to assessments, uh, y- most of it's just verbal. Like, tell me what hurts simply, and when do you notice it the most? Um, the main, I've come to find that things hurt for people when they're not moving,
Yeah.
when they're not using those muscles. So it just comes down to like just a short conversation before treatment because, we go in for anyone goes in for a massage for a 60-minute treatment. You want as much of that 60-minute time as you can.
Yeah.
Um, Personally, I don't when I'm getting treatment, I don't want to take a lot of time to talk about it. I'm just like, let's make the most of this time.
Yeah. Yeah. So you have
So
to,
a lot of a lot of it's verbal. I don't do a lot of orthos. Initially, when I first started practice 3 years ago, I was quite keen on them, but not so much anymore. I just want to get as much treatment time as we can.
Yeah, yeah. You probably have to be super efficient with your assessments just because people are paying for your time. So you have to know what's going on right away and then jump right into it. What kind of modalities are you using and what kind of techniques?
Yeah, so we were trained in school generally just Swedish massage techniques. Um, I've gravitated more towards the stripping technique,
Mm-hmm.
stripping along the direction of the muscle fibers. So I won't get too in depth on the neuromuscular effects and all that, but it's just simple, working up and down uh, along the muscle fibers, and then also frictioning mainly at like um, the musculotendinous junctions as well. Just different ways to inhibit or stimulate mechanoreceptors in the muscle.
Gotcha.
Um, and then my third would just be trigger point work.
Yeah,
So just hunting around with those elbows and finding the sore spots. And it's just like it's similar to foam rolling. Like,
gotcha.
sometimes I feel like I just thought about this right now, but I feel like a glorified foam roller, except who I'm treating, like they don't have to do anything.
Yeah,
So that sounds like a win-win.
yeah, yeah. Glorified foam roller. Do you do like cupping, Graston, anything like that?
Right, yeah. Yeah, I do myofascial cupping and Graston. So I don't own the overpriced Graston instruments, so
Yeah,
I can't call myself a Graston technique provider. I do perform Graston technique,
gotcha.
but I'm not necessarily a Graston provider.
Yeah,
Um, there are alternative uh, instruments out there now that the Graston patent, I believe, has run out.
yeah, it
But yeah,
has.
Graston and cupping.
I got a Graston tool. They used to be just grossly overpriced. I remember looking at a kit for like $1,500, and I just found one.
US probably, right?
Yeah, US, and I found one on Amazon for like $40, and it's like
Mm-hmm.
it's a piece of metal. Like how crazy can you get with it? But yeah,
Mm-hmm.
no, that was cool. And then obviously you just call it instrument assisted soft tissue, or if you want to use the trademark name. I don't think their
Yeah.
lawyers are after you at all. And then,
I'm still pretty diligent in my charting and I put IASTM.
okay,
I
cool.
never say it, I do Graston on anybody.
Yeah, yeah,
Uh,
yeah,
just want to be safe, I suppose.
yeah, cool. And then cupping, well, what is cupping? And I get this question a lot. What is cupping? What does it do?
So cupping is really interesting in the way that this is how I explain it to patients. When I'm working with my Swedish techniques, my general massage techniques, I'm working almost specifically with the muscle and or the tendons. So, but between like the skin, like the outer part of the skin and the muscle, you have layers of skin. There's like five or six. It's been a while since I took my physiology class, but five or six layers of skin, dermis, whatever you want to call it. And then you have blood vessels, and then you have fascia that runs all throughout the body. So those three areas that I mentioned or layers are being worked on when we're cupping. So basically, two things that we're doing. When I'm gliding the cups along, I don't do a lot of static cupping, but when I'm gliding the cups along, I am increasing circulation to and from the area by almost pulling uh, stagnant blood out of that out of the area that we're working. Two, we are working with the fascia, kind of like getting rid of or trying to reduce slash limit scar tissue slash adhesion in the fascia that can contribute to um, lack of range of motion and overall tightness anywhere throughout the body if left too long.
Gotcha. Cool, man. So, let's talk about advice. So you've been in practice for 3 years now. how was building a practice? And do you have any advice for any newbies out of school in building a practice?
So building a practice was pretty tough for the first couple years. Um, just not knowing what I wanted
Mm-hmm.
in a workplace or in a clinic, not knowing, not knowing what I deserved as a contractor, um, really led me to learning the hard way and, knowing what I was allowed to say yes or no to, as far as what I was being offered from a clinic or whatnot.
Mm-hmm.
Um, I also found that volunteering my services in the form of like outreaches, going to like family runs or like marathons, jujitsu academies and whatnot. It was all like it was a good learning experience in the way that I learned that people don't appreciate uh, your services when it as much as when it's free as much as when it's charged. So I really found diminishing returns when it came to volunteering.
Gotcha. Yeah, they have to have
Um,
some skin in the game.
yeah,
Yeah.
that's really it. And yeah, I did too much in my previous clinics trying to make up for their lack of marketing.
Yeah.
And I was getting burned out and it was really it's kind of a buzzkill
Yeah. Yeah.
for me at the time. It was just taking too much out of me and I kind of knew in the back of my mind that something wasn't right,
Yeah.
but because I didn't have the experience to know for sure, um, I didn't know any better.
Gotcha. So you work inside a multidisciplinary clinic, which is you've got tons of practitioners over. If you want to show your clinic, you can.
Yep. Yeah, I'm at Encompass Sports Therapy in Calgary. Yeah, we have we're over 20 contractors, I believe.
Yeah.
And yeah, we offer I'm gonna forget something here because there's a lot,
Yeah.
and I'm just going off the top of my head, but we got chiropractic, physio, massage, pelvic floor physio, orthotics, exercise rehab. Uh, Along with the orthotics, the same practitioner does gait analysis, and plumb line testing.
Nice.
Um, don't ask for me to just explain that because I just learned that she did that this week. But
Yeah.
yeah, those are eight of the uh, oh, and osteopathy is
Okay.
another one that we offer. So
So you
nine
have
things that we offer.
an osteopath, a chiropractor, a physiotherapist or physical therapist if you're in the States, and a massage therapist, all operating under the same roof, basically, is what you're saying.
Yes,
That's
sir.
yeah, that sounds like Canada right there.
Yeah.
There's definitely a turf war between all those professions, so it's kind of cool to see them existing in the same workplace.
Hmm.
So who calls the shots?
Who calls the shots in terms of
Treatment plans, like is there someone running the show, like which patient goes where?
not necessarily. Usually people when they call in for the first time or set up their appointments online, they know where they want to start.
Okay.
And then depending on what I'm seeing, in regards to like the muscle work that we're doing, what I'm
Mm-hmm.
talking about with the patient, um, it, in most cases, it's usually unfair for me to say that massage is the absolute end all be all for somebody.
Yeah.
Although I have found it quite difficult to refer outwards from massage to another discipline.
Mm-hmm.
I'm not quite sure why, if I need to work on my phrasing, how I come across with it, but
Yeah.
that's usually how I phrase it to them. Like it'd be unfair of me to say like this massage with me is gonna make you feel better for the rest of your life, and
Yeah.
you're good.
Yeah.
But no, it's pretty free reign for contractors.
Cool.
Um, I've been blessed to have like a good amount of referrals from fellow practitioners. I'm just like working on returning the favors when I can, but
Yeah.
again, it's not so easy of a sell.
Gotcha. Yeah, usually the acute cases, I'm sure, will seek out a physio or a chiro, and then that will be referred to you rather than the acute cases going right to massage, probably. Yeah,
Yep.
gotcha. So, over the past 3 years, how have you evolved as a therapist?
Ooh, that's a good question. So initially, when I first, or I should say, when I was finishing up my schooling in 2018, I had actually taken my myofascial cupping course
Mm-hmm.
at at the conclusion of my schooling before I even went into practice. So I was really keen on myofascial cupping. I didn't quite know at that time the potential
Yeah.
for that technique. Um, so there was probably I took about like a 6 to 8 month almost hiatus from cupping. Like I never even bothered putting them in my treatment cart. I never really had them ready.
Mm-hmm.
I'm just like, I don't know if I really if this was a good investment, like investing in the cupping. So, but since then, I've really, I don't want to say, well, I've changed my tune, but it's not just because like I've had great experiences with cupping and implementing it in combination with the muscle work, the
Yeah.
general massage. And then I've also, taken that Graston M1 training. That would be a couple years ago now.
Yeah.
So just like slowly been adding new things to my arsenal, new weapons to my arsenal, and trying to perfect or trying to get as close to perfection with those as I can.
Yeah, that's the so like that's the thing about massage because it's a modality, but it's also a profession. So sometimes I feel like those two get confused with each other because a massage therapist they can do cupping, but that's not massage. They can do instrument assisted. So they I feel like we need a new name almost because people get
Like
confused. Like, why are you
like
putting cups
massage
on me?
therapists.
Yeah,
Right.
why are you
Yeah.
cupping me right now? Like, why aren't you massaging? But there's I feel like all these practitioners are fitting under the realm of manual therapist. So
Hmm.
maybe we should just cut out physios, cut out chiros, and just call everybody a manual therapist. And like that'd be wishful thinking, I think.
Yeah. As a massage therapist, I like the idea.
Yeah, yeah,
Being lumped in the same category as chiros and physios is
yeah,
would be quite flattering, but
yeah,
I don't know if I could see that happening.
yeah. Because there's different genres of like you're a very treatment based therapist, and then you can go to spa based therapist, you can go to sports based and relaxation. There's definitely different lanes of the profession, I'm sure.
Hmm.
Yeah.
Yeah.
So what would you define yourself as, like a treatment based or
Um, in what regards? Sorry.
so like if you were working at a spa, you would be a relaxation based massage therapist.
Okay.
Yeah.
Gotcha.
So what would you categor what would you classify yourself as?
Deep tissue slash therapeutic.
Yeah.
Although
Therapeutic.
deep tissue is relative.
Yeah.
Um, it's more of I hate to say it, but it's more of like a marketing thing to call myself a deep tissue
It's
therapist
it's
because
definitely a
everyone's
it's definitely a buzzword.
yeah.
Yeah.
Some people just love the sound of it. It sounds badass, and a lot of people are about that. So
Yeah. It sounds like the more pressure that you put on somebody is directly related to how much benefit they're going to get by their treatment. But that's just kind
it
of
almost
human
seemed that
nature.
way.
Yeah. Yeah. So do
Yeah,
you
no
use
pain, no gain,
yeah, do you just
as I hear a lot.
do you blow people up or I hear stories like that all the time where people are like, dude, my massage therapist is the best. Like, I can't walk for 4 days afterwards.
Yep,
is
hear
it
that a lot.
is that the goal?
I've I mean, for some people it is, but I've I've really worked on talking people down
Yeah.
from that. There's gonna be diminishing returns with higher pressure in the sense that I usually phrase it as that if we're altering our breathing patterns, meaning like we can't breathe normally during treatment,
Yeah.
we're going to be doing the opposite of what we want.
Gotcha.
Because when we hold our breath, that's when we're usually stressed. Like that's what we do when we're stressed. We're trying to be more efficient and, conserve oxygen, get oxygen to our muscles. So, um, we're just gonna be tensing up. It's gonna be doing the opposite of what the treatment is designed to do or intended to do.
Hmm.
So, um, yeah, sometimes or oftentimes there's gonna be diminishing returns with higher pressure.
Gotcha. So yeah, the pressure being high is not your main goal.
No, not necessarily, even though, like I said, I do market myself as a
Yeah, yeah,
deep tissue massage therapist.
yeah,
But just keeping that informed consent up and communication with the patient uh, is usually all you need to, maybe talk them down.
yeah, yeah. So I'm sure informed consent is a big part of your practice. Would be my assumption, as it is
Hmm.
in chiropractic and all forms of manual therapy. So yeah, how do you approach your informed consent?
Yeah, so informed consent would just refer to letting the patient know what you're doing and why. That really encompasses it all.
Mm-hmm.
The reason that like you said, it's important in all of the manual therapists practices, but specifically to massage, I think the reason that it should not ever be discounted or ignored or skipped is because one of many reasons is that the patient is in a vulnerable position. Like they're trusting you
Mm-hmm.
in the sense that usually they have less clothes on than they would for other treatments with like maybe chiro. They might be down to their underwear. Um, they might just have like shirt off or shorts off, something like that. So um, there you really have to. It's usually a good idea to uh, create an atmosphere conducive to conversation and
Mm-hmm.
so that they're not agreeing with things you say just because they think that they're in a position to say no.
Yeah, yeah,
'Cause- or I'm not comfortable with that because
yeah.
they are. There's no reason that they should feel uncomfortable, and I take that upon me to make it so.
Yeah, yeah. I found that the well, let's say the informed consent that I have botched in the past has been related to side effects, where you don't 100% like. Let's say if a technique is going to make someone experience some soreness, and then you don't 100% understand they don't 100% understand that when you're talking about it, and then the next day they're like, man, like I was really sore for a day, and then I felt better, but I wasn't you know I didn't know that was part of the deal. That's definitely something I've messed up in the past. Or
Hmm.
cup marks is another one. Yeah, you always mention those cup marks will stay on
Yep.
up to a couple weeks on people, which
Yep.
yeah, those nasty bruises you give.
Yeah.
I'm
Bruises.
I'm baiting you there.
Yeah, you are perfect. I love it. Um, so yeah, 99 times out of 100, the patient that I'm performing cupping on, they've either had it before or they've seen people have it done
Hmm.
or whatnot. Um, so when I let them know, like, hey, you could experience some redness that looks like bruising, which it's not because we're not rupturing any blood vessels, we're just getting stagnant blood moving. Um, there could be one out of 100 patients that, uh, even though the 99 say like, yeah, fine, it's whatever, like they're chill about it, the
Hmm.
one that you don't mention it to could have a photo shoot the next day,
Yeah.
which is how I learned the hard way my first week of cupping in practice to let every patient know what to expect.
Yeah. Gotcha. So let's what because you work with so many practitioners, what do you want them to do, like when they're passing off patients or when they're sharing treatment plans with you? what do you appreciate from other manual therapists? So let's say you're co-managing a low back case with a chiro. Information do you want, or what communication do you want with that chiro?
I'll start off by saying I appreciate anything
Yeah.
because it shows that that practitioner that's referring me or to me um, is really passionate and invested in helping that patient get better. So just the fact that they're reaching out to me to let me know
Mm-hmm.
shows that they really care. So that's number one. Two, if they just say, hey, I maybe I wasn't able to get into this area of the muscle as well as I wanted to. I didn't have enough time, anything like that, let me know.
Mm-hmm.
Uh, and they let me know to do so, to work more on that area, or maybe try something different, maybe in the form of like even, some gliding cupping. That's really helpful. Like just giving me a spot to start, what kind of pressure they like, maybe, um, yeah, what techniques they prefer,
Mm-hmm.
or even what techniques to avoid.
Yeah. So basically, your expectations are not that high. Just basically
No,
something. Yeah.
yeah,
Yeah.
just
Something to
something.
work with. I like it.
Hmm.
Gotcha. Let's say, uh, y- let's pick one. What is your favorite condition or symptom to treat? So shoulder stuff, low back stuff, any
Hmm.
injuries that you feel like you have a good handle on?
Yeah, actually, my favorite dysfunction to treat would be anything like elbow related because I love working on the shoulders. Like
Mm-hmm.
I love the rotator cuff. I love working on like triceps, like serratus anterior and the ribs,
Mm-hmm.
and pecs as well. Those muscles all can contribute to elbow dysfunction.
Yeah.
So the reason that I love working on elbow dysfunction, whether it's like lateral epicondylitis or medial epicondylitis, just seeing like hearing and seeing the patient's reaction when we're working on muscles in the shoulder and the rotator cuff and it's referring down to that area,
Mm-hmm.
providing them relief, like
Yeah.
that's just super exciting for me. Like I got goosebumps just talking about it right now because it's so cool showing patients how things can connect from the torso down to the arm, even as low as like the hand.
Yeah.
So anything that lets me work on the rotator cuff
Gotcha.
is is probably my favorite.
So let's say someone is coming in with elbow pain, um, on the shoulder. What's something you're definitely gonna hit?
What part of the elbow?
Let's go lateral epicondylitis,
That will probably be infraspinatus of the
infraspinatus.
rotator cuff
Yeah.
and tricep. Those two things. Infraspinatus, it's not always directly referring, but tricep work will almost always help with the lateral epicondylitis.
And what about medial?
Medial would be serratus anterior,
Yeah.
pecs,
Yeah.
and scalenes,
Okay.
I believe as well.
Cool.
Yeah,
Nice.
scalenes actually for both sides of the elbow. I might have to refresh myself, but yeah,
S-
I always pretty much work on scalenes anyway.
Yeah. 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 For anything shoulder related, definitely
Yeah,
helpful.
shoulder or elbow.
Yeah.
Hmm.
Cool, man. Well, thanks a lot for coming on today.
Yeah, thanks for having me. This was awesome.
Yeah, let's meet up. Let's do this again. Uh, if you want to contact Joel for booking, why don't you let us know how you can do that?
Yes, so I don't dabble in any social media anymore. Like I said, that was something that I got diminishing returns into investing as a practitioner.
Yep.
Just having found this awesome clinic with a great social media presence. So it would be www.encompasscalgary.com.
All right. Thanks,
And you
Joel.
can just book online there or look to see what we all offer at the clinic.
Cool, man. All right. Talk to you later.